D. I'm not sure how to pronounce that. Hello, good morning, Muiwa Shoyoye.
Hi, Zainab.
Hello, Lakumi. Hi.
Hi, good morning. So hi everyone, Zainab, Lami, Sharon. We'll start by 10:15. We're just waiting for more people to join in. They are not. Okay. Hi, Nonso. Hi, Ebuka. Welcome. Hi, Benga. So, once again, good morning, everyone. I think it's just about 10:15 now, and we're about 10. So I think we can go ahead to start, and more people will join us as we go on. So I just want to confirm that we all can hear me. Can anyone confirm that, please?
Yes, we can.
I can hear you.
All right, thank you very much. The way this session is going to run, we're going to start with introduction. So everyone will just say their name and just a sentence or two about themselves, what they are doing at the moment and what they hope to get from this session. And this introduction is going to end with Dr. Jinadu. And after that, he's going to go ahead and just take us through his journey so far. And he said something earlier about him still using his stethoscope. So he's going to expound on that. And when he's done, we'll have the opportunity to ask questions. So, right, so I'll go first. Sorry. I'm Olakumi Oguyemi. I am a medical officer, currently a COP member. Started Doctors Without Stats majorly as a way to have more conversations with doctors outside of the clinical space and to create a community of people who have like the same interest or similar interest with you, and just have that sense of community to be able to talk to people who are going through the same thing as you. And so far, we've had over 6-7 sessions with different doctors in medical innovation, in finance, in epidemiology, and other aspects. So, yeah, and I hope this session would be as insightful and even more so than the others we have had so far. So, Asabe, can you please introduce yourself and what you hope to get from this session?
Hi, everyone. Good morning. My name is Asabe Meyaki. I'm a medical officer and a COP member at the moment, looking to transition finally out of clinical medicine in probably finance or development space. It's nice to be here, and I hope I get like practical insights on how to get out of clinical medicine eventually. Thank you.
Right. Thank you, Asabe. Ayadeji. Hi, Ayadeji. Can you please introduce yourself? All right.
Hello. Yeah, I'm Dr. Paula Deji. I think, yeah. So, I'm a medical officer currently with the Hospital Management Board in Ondo State. And, it's my first time of joining him. And just to add to my knowledge, I do want to retain, I don't want to transit, but I want to just add to my knowledge and to just have knowledge of other things outside of medicine. That's why I'm here. Yeah.
Thank you, Dr. Fowler. Ebuka Chukwu. Ebuka Chukwu, can you please introduce yourself?
Hello, good morning, everyone. Can you hear me?
Yes, we can.
Hello.
Yes, we can hear you, Ebuka.
Yeah, my name is Dr. Chukwu. I'm currently a 500 level medical student at Abia State University. My reason of joining this is just to get an insight, right? Of I really don't want to go into medical practice, so I'm looking at. I don't have an option of where to get into it, so I'm considering, or rather, I want to get an insight of where to get into at the moment. Thank you.
All right, thank you, Ebuka. Benga Alabi.
Okay, good morning. Hello,
Good
can
morning,
you?
Benga. Yes, we can.
I'm Benga Alabi, a 400 level medical student at OAU. So I'm joining the program to just learn more about opportunities both in and outside medicine. Thank you.
All right, thank you, Benga. Lamide.
Good morning. My name is Olamide Ishola. I'm currently a medical officer at the psychiatric hospital in Yaba. And my main reason for joining the meeting is basically to just have an insight of all the other possible options outside of the clinical practice. Thank you.
Thank you, Alamide. Nonso Udechukwu. Hi, Nonso, we can't hear you. All right, I think we should just move on. Nonso.
Hello.
Hi, Nonso. Good morning.
Can you hear me?
Yes, we can.
Okay. Hi. I am Idechukwu. So I am currently driving. I am a medical officer at Avon Medical Center. My main purpose for joining this meeting is to find avenues to combine my non-clinical skills with my clinical skills to successfully practice medicine in whatever field I do. Thank you.
All right, thank you, Nonso. Oluwafemi Talabi.
Hi, everybody. I'm Femi. I'm currently in first year residency in psychiatry in the NHS. So my reason for joining this meeting is to just gain an insight as regarding other non-clinical aspects, basically.
All right, thank you, Femi. Taufik Okuneye.
Hello, good morning.
Good morning, Taufik.
Yeah, I'm a medical officer with the Lagos State government. I just want to, well, the reason for joining is to have more info about the non-clinical aspects of medicine.
So I think we've gone through everyone. So we're going to go on to Dr. Jinadu. But just before we do that, we recently started a closer niched community where we have conversations like beyond just this 1 hour sessions and what we have on Twitter and our other social media pages. So if you would like to be a part of that, I'll put the link in the chat box so you can fill the form while the session is going on. So Dr. Jinadu, can you please introduce yourself and then we would go ahead with the session. from there.
Good morning, ladies and gentlemen. My name is Olakitan Jinadu. Like many people here, I also have a background in medicine. I graduated medical school a few years ago, and over the course of that period, I have also gained insights through advanced learning in health systems management, healthcare economics, and the concept of universal health coverage, so to speak. I currently work now as a health system specialist with World Bank operations across 5 sub-Saharan African countries. And I believe that in that period, I have transformed from a doctor in the hospital to a doctor outside of the hospital. I said earlier when I was having my introductions with Kumi that I believe I'm still a doctor with a stethoscope, and later on in the quest today we will discuss how I am still a doctor with stethoscope. Thank you very much.
All right. Thank you, Dr. Jinadu. So I think now we can just go on. You can take us through. So essentially, this is, as you said, it's a conversation. So you can take us through your journey, how you got to where from medical school to working in the World Bank at the moment, and also other insights. It's a conversation really, so I think questions can be thrown at any point. But for the first 15 minutes, we'll just be purely you, because giving us what you have for us.
Okay, thank you very much. First and foremost, I'd like to do a mic check. Is it better now for everybody? I would wait for a feedback before I go on, because I see the comment which says that I am not very audible. Oh, okay. So, like many people here, I also started off wondering what I can do and what my purpose might be when I'm done with medical school. So this interest did start off in medical school, but it didn't quite crystallize till I think my service year. And I say this because up until the time I was doing my internship as a medical officer or medical intern, or house officer, yeah, that's the word. At Luth, I honestly thought I'd be a great surgeon. So for those who still think that way, there's no problem with it at all. Over the period of time, I have transitioned to who I am today. It's an interesting journey, but was also a journey by chance. So I graduated medical school in year 2012 and was a medical officer or an house officer at Luth in the year 2013. Now, the year 2014 was a very dramatic year for me because at that point in time, it was really clear to me a few things. One was that I had not a lot of significant interest in leaving the country. That was on one table. On another table, I'd come to realize that clinical practice wasn't particularly fulfilling for me as a practitioner. And bear in mind, I was a good clinical physician, to say. I believe that amongst my peers, my clinical skills were a little over above average. So it wasn't just like every other person. I was good in spotting on diagnosis and all of the clinical reviews. It just wasn't something I liked. So I began to ask myself and I began to think deep, what would I do following all of this? And I recall in year 2014, there was a medical outreach program in which someone had called me to just be a part of the team. Down the line, it became clear to me that, oh, you might actually have a flair for this type of thing. And following that outreach, we did a few others. By the third or fifth outreach, even though I was called in to join in at the beginning, I had become the chief planner for that series. And that translated in me setting up my own small NGO at the time. I recall that we named it Save a Child Initiative at the time. It was a mass deworming campaign for children, especially those living in neglected tropical diseases endemic areas. And so what we were doing was that we were deworming children in schools. But becoming that individual or setting up that organization where we could deworm children in schools also required a lot of administrative processes. One of such processes was that we had to seek approval from the Lagos state government. Now, in seeking approval for government has got several arms. So we needed to sort one approval from the Directorate of Pharmaceutical Services of the Lagos State Ministry of Health that the medications we intend to distribute in the schools weren't poison, and that had its own procedure. We needed to seek approval from the School Health Directorate of the Lagos State Ministry of Health, and that had its own procedure. And then we needed to seek approval from the Lagos Education Board because we were going into schools. And it became clear to me immediately how managing the health system or managing activities in the health system was cumbersome and also interesting at the same time. So down the line, I realized that those series of activities gave the type of fulfillment that indeed I had hoped for in clinical practice, which was absent. And so I decided to further my education in that regard. So first, I got a master's degree in health systems management, which was also a very interesting journey for me because it was a class for people who had some sort of experience in public health, and I had written a very fantastic introduction letter about all of my activities in terms of doing the mass drug administration, all of my interrelationship with all of these government agencies and departments that I had mentioned earlier, and also how I have a very, very pure interest in making the lives of people in developing Africa better. But in that program, what was very absurd was that I was very young in that classroom. And I think maybe if the university had noticed that, oh, this guy is just a very young person, probably they wouldn't have granted the admission for that program. And many people came in the classroom with sometimes decades of experience, sometimes 7, 8 years in, but the average years of experience of those who were in that class was around 7 to 8 years, and I was in that class with them with 1 year NYSC experience and what they call it now, and doing this all of my NGO work by myself. So it was a, and that's why I said it was a journey by chance. But I also told myself in that classroom that despite the fact that I was coming in with the least experience and exposure in the space, I will make the best of the opportunity. And I recall as the year was ending, I was also beginning to ask myself, now you have you almost have a master's in the bag. What are you going to do when you leave this classroom? Because now the bubble is about to burst. You said you like public health. Now all you've done, you haven't really made any earning from it. You've only just shown the world or shown people around you that, yeah, you have genuine interest to do things like this. As I thought to myself, I began to reason that the fantastic place to launch a career like this would be to work within government and understand better how government works. I believe that for me to be able to deliver the change I do, hope to inspire, that I needed to also be part of the system that, make these policies, that make these laws, that make these, whatever it is you want to call it. But then I needed to be a member of the Central Planning Committee. While I thought about that, I also realized that joining government as a typical civil servant might not provide the exposure that I had hoped for, and I wanted something closer to policy development. And I recall then in 2016, I wrote the Commissioner for Health in Lagos. And I must say to everybody here today, whatever it is that your aspirations are, do not be scared to express yourself in the way you believe is most appropriate. I recall writing the Commissioner for Health, and I'll share a good experience of, or a bit of background on how that went. So, you may recall that I said that I had been in a health management classroom and I was the youngest in the classroom, and I was able to deceive the university not to realize that in fact I was young until I got in the classroom. So I knew that if I was going to write the commissioner, I also needed to make an impression which would not make me seem like who is this guy writing me? I'm sure he gets a lot of letters every day. So I recall making a letterhead in my name. I had this very fancy letterhead. I'm not sure. I kept copies of that letterhead for a very long time. And they were printed in blue foil on white paper. So it was really attractive. I just had there Dr. Olakitan Jinadu, my MBBS and my master's degree, both locked in there. And I wrote a letter of how Lagos is thriving. And as the leader of the health system, I'm sure that the responsibilities are enormous. And I told him that he needed a technical assistant, and that I'm that technical assistant he needed. Yeah, it was a big one. After writing that letter and dropping it off myself, I began applying to other logical places that people who had my type of degree would apply to. So I started applying to HMOs. I was applying to some NGOs too. And a week after I dropped that letter, I got a feedback because I had put my phone number on the letterhead too, just in case someone, and my email address. So I got a phone call. The person had introduced themselves as a desk officer at the Ministry of Health, and that they were calling me regarding a letter that I had written. And they were calling, I think, the HR office. So I was like, okay, no problem. I'll make myself available. So I went to the HR office at the Ministry of Health, And I remembered the lady asking me, so what do you plan to do? Why not join the civil service? And I'm like, oh, well, this is not a position available in the cadre in the civil service. And what my hope to do, or what my hope for work at the Lagos Ministry of Health would be, was very specific to that position. And I wasn't interested in the civil service because then the civil service could post me anyway. And I recall she advised that, oh, the advice I'll give you as a HR or admin specialist or director, which she was anyways, was that you join the civil service and then back up, we will back up your posting to the ministry with this. I said, okay, thank you very much. And then I wrote a second letter to the commissioner after that event, explaining to him why it is important for me not to join the civil service. Are you guys following? So I wrote a second letter explaining why I shouldn't join the civil service. And why, in fact, if I join the civil service, it would defeat the purpose of my working as that neutral technical assistant that I hope to be and that he also needed. And so after that second letter, 3 days later, I got a call again inviting me to an interview. In that interview, I was interviewed by a lady. No, I was interviewed by 3 people, actually. The director of disease control at the time, and the Global Fund grant manager at the time, and the director of, the head of planning for the ministry at the time. In that interview, I made it clear to them why I would be an advantage. So I wasn't saying I was looking for a job. I wasn't telling them that, oh, I'm coming here to learn. I was telling them that, in fact, there are many missed opportunities in the system, which I believe that working with the commissioner, I might be able to help them fix. So I was pretty much explaining to them how I could be a benefit, not I'm looking for a job, I want to learn, I want you to, it will be a fantastic experience for me to, no. I was telling them, also you guys are currently doing this, and that. At the time, the social health insurance program in Lagos was still in the pipeline, and the commissioner was the chief of the core implementation team. So I'd researched my employer to a little bit and how he definitely will have a lot of challenges monitoring timelines and all of that, and how I would be a very good assistant in terms of project management in that regard, how my experience in policy writing and review can be used to improve some of the old policies, how my knowledge in health systems management can be used, in fact, in designing improved strategic development plans for the State Ministry of Health, and all of that. So I was very specific in my pitch to them. And they also realized early that, okay, this might be someone to have a relationship or offer a job. After that meeting, they said they would get in touch. And I thought maybe, it's government, so they would get in touch maybe in a week or 2 weeks. But when you know your value is when a slow system begins to act fast for you. So I recall the following morning, I got another call if I'll be available for a meeting the next day. And it was another interview pretty much. It was another interview by 3 other sets of people. There's the director of planning, research and statistics at the ministry, the director of pharmaceutical services, because of course I had gloated about the deworming program and how we had made successes in that program. And then also the director of admin, and that's the admin, the HR director was there again. And I recall the HR director opened the meeting and said, so why do you think you shouldn't be a civil servant? Because I heard you wrote a letter saying you shouldn't be a civil servant. And I explained to her that in civil service, there's a cadre, there's a grade level, it's a conveyor belt. And the type of role that I intend to take up at the ministry, you can't take up such a role if you're not at level 15. And I don't think I have what it takes to be a level 15 officer at the ministry as I am. But the job needs to be done by somebody regardless of not whether they are level 15. And so I'm relinquishing that opportunity to be a civil servant because I want to do the work of someone who's level 15, and I don't think you'll take me at level 15. She smiled. She was like, okay. Long story short, I didn't realize one important thing till my third interview, which was with the commissioner. Apparently, I'll tell you a few things. So the first day I met him, so I was called after that second meeting, then I was called for a third interview 3 days later. In fact, I was called around 8 o'clock, and I was asked if I could come in for an interview at 3 p.m. that same day. I was like, yeah, it's fantastic. So at that third interview, I was already also feeling stressed. Like, so what's happening here? I keep meeting people. So when I got to the ministry, I recalled that the person who was handling me at the time then took me over to the commissioner's office. And as I walked into the office, it was my first time ever meeting him. So he looked up and said, sorry, who are you? I'm like, oh, my name is Olakitan Jinadu. I was invited for an interview with you today. And then he looked at the paper in front of him and all of the minutes and all of the comments. And he looked up at me again. You know the first comment he said? He said, I thought you'd be older. So obviously, yet again, I deceived him. So when I sat, he said, his opening statement was, well, I thought you'd be older. Are you sure you have the experience? And are you sure the person described in all of these papers that I see here is the same person sitting in front of me? So I had to make him understand again, because apparently prior to the time, he had also seen that letter and had seen immediately the use for such a person that I described in the letter. And when I wrote back saying, oh, I shouldn't be a civil servant and why I shouldn't be a civil servant, not realizing that I was saying truly yes, why what I shouldn't do, or why that role didn't require someone who was a civil servant, he also knew with justification, even better than I did, that truly this role would require somebody who's ready to work, who's not a civil servant. So you see how you knowing the ropes, knowing what you want to do, and doing exactly that and not bending it because somebody has asked you to can make a difference in your life. So when we got in the chat, he asked me about what I felt about social health insurance and a few other things that were really just technical stuffs. And he said to me, are you really sure you want to do this job? Because I'm not a very easy person to work with. He said, like, I recall in all of that conversation, then he said after, like, you can start immediately. So all of this, it was already around 4 o'clock. Like, so remember, I'm like, it's 4 p.m. already, isn't it closing time? But of course, when he said I could start immediately, I resumed that same day at 4 p.m. And I worked till 10:30 p.m. I didn't complain once that I was ready to leave. I had no role or responsibility yet. Nothing had been pushed to me to do so. I just sat there till 10:30 p.m. when it was closing. And when he came, I was shocked. He was like, "Ah, you are still here?" I'm like, "You said I should resume immediately." Yeah. And then they accused the other people in the office. You people didn't tell him to leave. Like, you know exactly what he was even doing and all of that. Okay. So the following day, I resumed, and my journey as a technical assistant to the Commissioner for Health in Lagos started. Now, during that process, I became exactly the person I had described in the letter and more. I didn't wait for people to give me work. I went ahead and did things that were needed to be done. I didn't wait to be invited to meetings. I showed up at meetings, took my notes, and walked away. It didn't matter whether or not I was invited. I was technical assistant to the Commissioner for Health in Lagos State. And by such, any activities of the Lagos Ministry of Health, I'm invited. And so even if you say, oh, you're not invited, once I give you such a clear feedback, you would know, okay, this person knows what they're doing. I better just leave them. I might not make any comments in the meeting or note, but of course, the decisions in that meeting would affect all Lagos residents. And I believe I had a duty to prove any decision that was being made under the management that I served. I also didn't realize that as I did all of that, many people noticed. It was under my supervision that Lagos State government wrote a first technical report that was spiral bound in a hard book regarding one of their activities. Usually they would write things like this. Sorry, things like this, and it would suffice. And then they put a cover note of stuff like this with it. The reason why I still have some of this document is because till today, despite working for the bank, I still continue to do a lot of work for the Lagos State government. But back to the main conversation, it was not until then that we decided, or I worked with a unit and I explained to them why they should prepare a publication that is hardbound spirals with a back cover, with soft copies, people in master's program on their seats searching for information to do projects from government. They are easily downloadable online and all of those type of things. I'm like, we don't normally do that. I'm like, see, we don't normally do it, but now this is 2017. We should be doing that. It was so I wasn't there just to go and resume in the morning and wait for someone to boss me. I said, oh, go and do this, go and do that. I was there to make a difference in the activities. Fast forward to 2018, as the regime of Mr. Ambody ended, and as I was a political appointee of government, it also meant that my regime was ending. The boss I was also working with at the time, that's the Commissioner for Health at the time, had also been commissioner for 13 years and didn't feel the need to be commissioner anymore. And I recall that as he searched to handpick someone who could be commissioner, who he could recommend, I recall that he also called me once to ask me if I would like to work with new commissioner because he felt that what I was doing for government was very important and all that. But also I knew I was there. Recall that I said that I was there to learn the ropes. I was there to see what should be done and how it's being done and how difficult it is to make change within such a system. But I wasn't there to sit down there forever. And also I wasn't there, or I didn't believe that in my life, all I could ever be was a technical assistant to the commissioner. So I told him that I wouldn't like to work with the person. He was really glad. He was like, yeah, he was hoping that I would say no and that we could continue working together in the private sector because the commission had also set up a health consulting organization, just like Doctors Without Stats. But more importantly, he had envisioned also a career where he would begin to write technical documents for government while he was outside government and become a sector health systems consulting leader. And that wasn't part of my plan. So also breaking the news to someone who had given me such leverage and opportunity to make such differences in the system that, oh yes, this is your private sector journey. I wish you well, sir, but I wouldn't be a part of it. It was difficult. So I needed some level of maturity to be able to break such a news without also wrenching the relationship between us. Because it's total assumption when I said, oh, I wouldn't like to work with the new commissioner was that I would like to continue to work with him, which wasn't also the case. So I recall doing a lot of consultations in that period. So my perfect excuse was, and I had started a part-time program anyways in healthcare economics. It was a split sites program, so I was shuttling home and abroad doing that program, but I had never really made it a big deal. I had just always taken an excuse. So I told him that, oh, I've taken the excuse to go and write my final exams, and that when I'm back. As I left to write the exams for that program, all that bothered me other than writing the exam was how to break the news. And I recall once again that I had this fantastic letterhead. So I picked one of it and I wrote him a long note on how I wish him well and how I would still love to work for him again if he's ever in government, but that his journey in the private sector wasn't just mine. And I recall that rather than writing or calling or sending a WhatsApp, he also wrote a letter back wishing me well, saying that definitely if he's ever back in government, he would require my services. And that's how we parted ways. When I came back to Lagos, I was back again, jobless, and thinking to myself, what will I do? Unknowingly, I had developed so much social credit and professional worth that the moment people started hearing the rumors that I had disengaged with Jide Idris, my phone started ringing. So I was coming back to Lagos jobless. I'm thinking, oh, you are jobless, you need to find a job. Not realizing that as I wrote that letter and he responded, he was telling people, oh, Kiton even left. And I recall that a senior health system specialist at the World Bank, whom I had met on the job working as a technical assistant with Lagos State government, called me on a Wednesday. So this is my World Bank story. He called me on a Wednesday and said, could you please share us the most recent copy of your CV on a Wednesday? And on Friday, I resumed at the World Bank. So you see how such a highly sought position became so easy because I had developed professional credit. People would say, oh, so how do you get into the World Bank? And I tell them, for you to get in the World Bank, you need to work yourself in such a way that you become noticeable to actors in the World Bank who would recruit you without prejudice. I didn't sit in front of a panel again 2 or 3 times to convince them why I was valuable. As the offer from the World Bank came, three others offers also came, all offering me appointment, not because I had interviewed, but because I had demonstrated how useful I could be in a system. And so I was telling Kumi that I still use my stethoscope. Yes, maybe not to check heartbeats anymore, but the essence of a health system, it has a beating heart itself. And to check the beating heart of a health system, you need to begin to check things like healthcare access. If there's equity in this access, access of people to social health insurance, client satisfaction after clinical contact, all of these type of things are the heartbeat of a health system. And I believe I still use my stethoscope, maybe not the figurative one that Kumi refers to when she says doctors without stethoscope, but I still use my stethoscope to really check the heartbeat of the healthcare system. At the World Bank, when I recall when I resumed, my offer was just to be a health system specialist in Nigeria. And also, I wasn't looking for more really at the time. It was a fantastic opportunity. Beyond being a fantastic opportunity, I also felt it was a fantastic leapfrog on my profile as a person to have worked for government and now to work for a leading development organization that has global reputation anyways. And so working as a health system specialist for the World Bank in Nigeria was a fantastic opportunity. But because my motivation had never been the position or the job or the fanfare around it, immediately also at the World Bank, I got to work. And it didn't take long before other countries who were having similar programs that I had worked on and having issues began to invite me to come and work with them on their project. And that's why at the beginning of this meeting, when I introduced myself, I said, I'm a health system specialist with the World Bank across 5 sub-Saharan African countries. So between year 2019, when I resumed at the World Bank, and today, because of the value add that I have created within the organization, I now have to work across 5 countries. So my sincere advice to everybody here is that whatever you do, know with clarity what you hope to achieve from it. And when people tell you, oh, you're going about it the wrong way, or that thing you're doing, are you sure there's a way there? Don't talk to people who might be able to reaffirm that there's an opportunity there. Or if you do believe right from the depth of your heart that, oh yes, this is what I plan to do, and that's what you just go ahead and do it. If you had asked me in 2012 when I got my medical degree that 6-7 years later I'll be working for the World Bank. Before then, as at 2012, I'd never met anybody in my life who worked at the World Bank. And as at 2012, I didn't even know doctors worked at the World Bank. As at 2016, it was the first time when I was working for Lagos State government, I met somebody who introduced himself as a doctor and a health system specialist for the World Bank. The day I met that person, I told myself that in another 10 years, hopefully I should be able to work for an organization like that. I didn't even say World Bank because I thought it was a far stretch, maybe the WHO or any of the other UN agencies. 3 years later, I started working for the World Bank. And I didn't apply to a position at the World Bank. The World Bank offered me a position. And it took them, from the time I submitted my paperwork to them, it took them 48 hours to make a decision on me. You can't ignore all of the work that I did between year 2012 to year 2016, because all of those were the foundations of many of the things I do today. Even though, as at that period of time, I was earning nothing. And it seemed I was foolish. And I'll tell you why it seemed I was foolish. In that period of time, many of my colleagues started working for the Health Service Commission. A few others started making plans to relocate and become doctors in other parts of the world. And everybody was really making plans that were concise, and I was the one with children in schools. And I was planning medical outreaches. If I didn't believe for sure that maybe there was a future down the line, I could have stopped and maybe join the Health Service Commission and be in the civil service, or maybe work as a medical officer in the UK today. And for those who've chosen those paths, so long as that is what they wanted, then it's completely rewarding. But if you don't think that, oh, what I'm currently doing is what I really want, my advice to you, even though if you're trying to chase your dreams, it might mean maybe losing out momentarily. Don't be afraid to do that. I don't think that um, anybody should be motivated really by money. Money is good to have. Let me be very clear. Money is very, very good to have. It makes life easy. It makes your thinking clearer. It makes many things better, yes. But you know what is better than money? Motivation and hard work. That that can make you more money than money can make you itself. And I always tell people like Elon Musk, why do you think they go to work every day? They have enough money not to work. It's because they are motivated and they are doing by purpose. So don't be, it's difficult not to be the person who's not motivated by money but by purpose. But it's also best that you try to balance both, especially in your career. I hope that I've been able to convince many of you and reaffirm some of your thinking and not confuse you. Thank you very much, guys.
Um, hey, thank you very much, Dr. Jinadu. So this was actually like really, I don't know, it felt kind of deep, even though like, yeah, but it was really interesting seeing the journey so far. Now I would just like to ask, does anybody have any question to ask based on everything he said so far? Someone was asking what masters it was that you mentioned that you did earlier. Was it a master's in public health, or was it a specific niched master's?
So it was a specific niched master's in health systems management, but there's no way you can do a health systems management master's without um, the knowledge of public health. So the truth was, and that's why I said that I was in a classroom of people who were older. Majority of the people who were in this master's program had the typical MPH, and they were already working in the sector, and they were already becoming maybe management executives in the health system, and as such became interested in further learning about health systems management. Typically, health systems management focuses on public health, but more importantly, in policy reviews and design, and also management of commodities and infrastructure. So it wouldn't just, and commodities will also include things like human resources too, not just material resources. So it teaches you how to manage things from a systems perspective, and also how to write and review policies in the sector. So that's pretty much what the health systems management masters is. It has different names. Some people call it a global health masters, but the global health program is not as specific in terms of policy design and review like the systems management masters. But all of this are a spectrum, and there are many options out there today. Also, learning what school to go through is pretty important, because there are some schools that are more recognized in the development sector for different things. So if you wanted to do a program in epidemiology, there are some schools that are recognized there. And sometimes when you go to schools, it's not because of just what they want to teach you in that school. It's also because you want to use the name of the school to get you in rooms where people then want to listen to what you have to say. Many times it's not even about whether or not you're smart. It's about, can you get in the room to prove to people that you can make a difference. And sometimes you see many smart people haven't gone to some wrong schools, having problems getting in the room in the first place.
All right. So I was actually going to mention something about the schools, but I think you answered that, but maybe you can just expound a bit more. So I wanted to so you've answered the question I had. I wanted to ask, does the school you go to matter beyond just the program you did in the school? But I think you answered that already, saying it does. But how do you pick should I say, the best school, or how do you recognize those schools? Because I think especially sometimes in the case where maybe you can't fund your program on your own, so maybe you have to apply for a scholarship, and then some of these scholarships are tied to specific schools, like, oh, if you want to go to Edinburgh, then if you apply to this school, you have to go to Edinburgh. If you apply to this scholarship, you have to go. So you don't have the liberty to select. So is also doing a local master, maybe something in Unilag, UI. Does it also have its own let's say merits in the event that you cannot fund your education to some of these very reputable schools globally?
So I would like to tell everybody here, the most important thing in your success story, the most important thing in your success story, and the most important element of your success story is you, not the school you went to, not the grade you finished with in that school, but you. What do I mean? You see, the truth is this: some schools better position you for success. Some schools, once they see it, if they're reviewing 100 CVs and they see that school, whether or not that person could have even been the weakest link amongst those who have applied, that person will be invited to interview. So schools do that for you. But also, those type of schools that do things like that for you don't come cheap. That's the honest truth. And one of the things that I heard growing up, or when I started doing advanced studies, was that you've gotten your first degree. This is your choice. So if you want to do it, you also have to try to work, make some money. So I know that some people will be lucky enough to have parents who will just go ahead and finance all the way. Some others will probably have to apply to scholarship programs or pay out of pocket themselves or get student loans, whatever the case might be. So my advice to that niche of people is this. Number one, always go first. So if, for example, you can finance a University of Lagos master's, please go ahead immediately. You're better off with a master's than somebody who is still waiting to do a master's. You're better off. If I was to recruit someone today to work for me on a project and have someone with a master's and someone without. Even if I know the person without the master's can deliver, I will still invite the person with the master's to interview and just be sure that I'm not missing out on the opportunity of getting the best person to do this job. So that's what advanced degrees does for you. If you can't afford the expensive one, go ahead and get one anyways, because you're better off than someone who doesn't have it. Now, when you do have a master's from a school that you believe might be a problem in terms of getting in the big leagues, what you then need to do is you have to, I always tell people, as you grow, you see the reasons why it's important to have a network or networks or whatever it is you want to call it. And now, luckily, on Twitter these days, anybody here can tweet at anybody who's a sector leader. Everybody here can tweet at Akinbayomi, for example. Anybody here can tweet at anybody, even David Malpass, who's the World Bank president. Anybody here can tweet at him. So you need to use, if you feel, okay, maybe I've been applying for something like this and it's not happening because of the school I went to, you go in the room. And what I mean by you going, approach the person who is recruiting or working for the organization and state it clearly that I can make a difference. Forget that I went to Unilag. Don't say, oh, I can make a difference. I have, state the real cocoa. Tell them, yeah, I know that it's because I've gone to this school. That's why you think I can. But I can. And I understand what you guys do well and clear to know that I can make a difference. And these are the ways I intend to make a difference in your organization if you let me have a chance. Once you attack the elephant in the room that way, whether or not they will take you, they will call you to interview. So yes, schools do make a difference. They don't come cheap. If you have a scholarship program for a particular type of school, go ahead and do it. It's better than not having a degree at all. Do you get what I'm saying? If you're financing out of pocket, go ahead and do what's affordable. Do you get what I'm saying? But at the end of the day, when you have a degree and you think, oh, maybe doors are not opening, because meet people. And that's a function of you. You can't sit in a room somewhere and hope for what is good and not do anything about it. Meet people. Many of the industry leaders today, though they are taking people with degrees from Erasmus College and University of York, many of them have Unilag Masters. So remind them of how hungry and passionate they were when they had nothing but that Unilag Masters. Do you get what I'm saying, guys? Don't wait. Don't wait till you're able to, you're just wasting years. Don't wait. So if you have the opportunity to get a local master's from Unilag, UI, Abuja, wherever it is, go ahead and do it. Don't wait. Don't wait till your Chevening picks you up for a scholarship or don't wait. Just go ahead and do it. Don't wait. That is my advice. Thank you.
Thank you, Dr. Jinadu. Okay, someone, Benga, is asking that where did you get your master's?
So I've got 2 masters now and 3 diplomas, all postgrad diplomas. So that's about 5 postgrad degrees now. The first one was from Unilag. And it was because I didn't wait. If I had waited, maybe I probably would be doing just the first masters now, or maybe no masters at all. You understand? And in this lockdown, I've taken 2 postgrad diploma programs, all certificate courses. But if I had waited for something to happen, then I would have just probably still be in the wait phase now, or probably just still be waiting. So I'm going to reaffirm that do not wait. I've got degree from University of Edinburgh now. I've got a degree from Erasmus College now. All of these are fantastic schools. But it was because I got in the space first with my Unilag Masters. I started working, and then I was taking my own personal resources also to further and improve my person. But my advice to anybody who's listening now is do not wait. Whatever is available to you, get it. Well, luckily, these days it's easy to interrelate with people and prove to them that, oh yeah, you know what you're doing and you really can make a difference. So, but then they would want to have somebody who has a degree that matches the profile, whether or not it's from the best school, but they just have the degree that matches the profile. Even the UK today is taking doctors from Nigeria. So it must mean that but you have to be a doctor first before the UK will take you as a doctor. Do you understand me? You could say, oh, it's because whatever the reasons are, it just means that the most important thing is to have the degree first. So get the degree, wherever it's coming from. You can balance that out in the future, but get the degree first. Thank you.
All right, thank you. Nonso has his hand up. Nonso, do you have a question that you'd like to ask?
Yeah, I do. Hello? Can you hear me?
We can hear you now, sir.
All right. So my question is in a bit of one or two parts. So the first question is for an individual who still wants to stay in clinical practice, but at the same time wants to keep his options open as per exploring other parts of non-clinical but medically related practice. What's your best advice in terms of pursuing degrees that may be of benefit? That's one side. Then the other side is what places would you recommend for proper or eligible online courses for things like postgraduate diplomas and things like that? Thank you.
So to answer your first question, for those who are not quite sure what they want to do yet, and there's no harm in being not quite sure what you want to do yet. If you spoke to me in 2012, I would have said I was going to be a great surgeon. If you spoke to me in 2013, I would have said, oh, well, let's see how it goes. If you spoke to me in 2014, maybe I would have made a comment about being a fantastic healthcare planner, but however, I would still like to be in the health sector and do some hospital management and all of those type of stuff. If you spoke to me by 2015, I want to be a policy expert. If you speak to me today, well, I'll tell you, I don't even want to be a health systems expert anymore. I want to be a development expert. I want to start touching on things in education. I want to start touching on things in girls' rights and all of that. And so you can see that I'm growing. And like I grow, I expect any other person to grow. So if you still believe that, oh, you need to balance both, continue to do both. As you grow, you begin to know which one do you want to do and begin to gravitate towards what you want to do. For somebody who's not completely sure how they fit, it's best to also keep the options open. Regarding schools and online programs, I always tell people this. If you want to do an online program, at least do a physical program first. Online programs are not for people who are just starting off a career. So, for example, if you told me, oh, you have a master's online, and then the other person said, oh, they have a master's, but they went to class, I would be more attuned to pick that person with masters who went to class because that both of you are green-ons. And as green-ons, you will learn something in the classroom. If somebody who is a systems expert is telling me, oh, they have an online master, that online master is just to show that, okay, I have the certification to prove, but I have the industry knowledge and experience to excel. And so it wouldn't matter whether or not they have an online master. So I always recommend for people, and this is a personal thing. Some people think otherwise, but I believe that for green-ons, people who are new in the space, it's always good or it's best to go to school. Do you get my point? So I don't really recommend online programs for people because when all you have is online program and you don't have industry experience, nobody's going to call you. That's the honest truth. I need to just address that elephant in the room right away. Nobody's going to call you. Nobody will call you. I'm sorry that I was a bit brash, but that's just the truth.
Thank you very much. I can talk, but
All right, thank you. Does any other person have any question for Dr. Jinadu? Any other questions? It seems like we have no other questions. So with that, I would just like to, do you have, oh, okay. Amanda is asking, what's next for you?
That's a very important question. Even though I don't completely know, but I know a few things. Certainly, I will continue to work in this space. I believe that now more than ever, I have very distilled clarity on what I need to do. My hope is what drives my ambition. So I'll say my hope. And maybe in that hope, I maybe can figure out what's next. I can't say exactly what is next. But my hope is this, that we have a health system in Africa that caters for all. That children in Africa can grow without deficiencies. And when I talk about deficiencies in the health sector, deficiency in access to good nutrition, deficiency in access to good education. Because I believe this, the world that we live in today, we can only make a difference in the world that we live in today if we live it a better place. And so my hope is what drives my passion. And I believe that my purpose really is to help Africa achieve this. Thank you. In terms of social media, Andrew, I will leave it, but I would disappoint you, Olaoluwapo Adigbola, because these days a lot of people come on social media and they talk a lot. Many of the people who talk don't know. That's the honest truth. If I was to tweet using an organization's name, it shouldn't be a problem. And I'll tweet my position for World Bank or whatever. But if I tweet by myself and people will come and ask me, why do you think this is this? And the person who's asking me has no experience, no knowledge, and then maybe we will start trading argument, or the person who's arguing with me doesn't have the background knowledge that I have. So it becomes a difficult space. I do read a lot of people, and to be very honest, not to disrespect anybody, but I just feel this is a small cohort, so I better put it out here. Many of those guys that are popular on Twitter, Ola Brown and all of them, they actually don't know how to fix the system or what works. And they don't have the back experience, but then they can communicate and they have big followership. Imagine how I get into an argument with someone like that about what works and what doesn't work. It would be like a social media, what I call it, model for me. But it might not necessarily be because she's right and I'm wrong. It might just be because there's information gap and the followers don't know better. Do you get what I'm saying? So, and that's why I'm very careful on social media. I do have an handle. I think the handle is, if you search my name, Olakitan Jinadu, as it reflects on the screen, you will see me. But I try to stay off conversations like that. But most importantly, I use my social media handle to follow many development organizations, which I think you all should do. So whenever they have new reports, new papers, they always post it with a link, and I just follow immediately to read and update knowledge. So I believe that you also can also use your social media handles productively as I do mine, but I do stay off social comments because I try to be very careful in engaging people on social media because it's a dangerous place. I'm sure some of you agree with me, but I think you all should use it to follow the official pages of many of the development organizations in spaces or in finance or in anywhere that you feel that you might find yourself. And that would also help you in building your understanding of the space and also fortifying your interest. So you can do that and also try to read less of people who don't work in the sector, they don't know, but then they're social commentators to me at the best. They are not experts, they're just social commentators. So try to stay less of the amount of information you consume from places like that. But for anybody who wants to follow me, my social media handle is Olakitan Jinadu. You see, once you search Olakitan Jinadu, anywhere, Twitter, Instagram, anywhere you see it. But I'll disappoint you because I don't put a lot of technical stuff there. I just keep it as a social media handle and not a technical media handle. If you want to get with me technically, I think forums like this are best for me to share my opinions and also and their young minds or green minds in the space on how to navigate a career. I'm always reachable on any of those social media platforms. If you have any questions or if you think that, oh, there's something that is going and you want my opinion on it, you can send me a DM and I'll be very happy to reply in the DM when it's just a personal conversation between me and whoever it is. But I try to stay off dropping social media content that are technical because sometimes it just affects the wrong people. And being right or wrong can be judged on social media anyways. Thank you very much, guys. There's a question here from Lamide that says, Dr. Jinadu, where you are at in your career, does it feel like you have found your purpose? So let me first say this, Lamide. I'm nowhere in my career. I don't think I'm a big person. The moment you think you're big, then you have a problem. Do I think I found my purpose? Well, I've always liked what I do. So, but I feel like my purpose is beyond what I currently do. You know, I said that I want an Africa that every child has access to good health, good nutrition, good education, you know, and Africans are more competitive and respected globally. So if you ask me if I have found my purpose, yes, I believe my hope drives my purpose. But am I there yet? I'm still far from it. Okay. Are there other questions, comments? And I would like that some of you turn on your microphone and say something to let's hear your voices.
Does any other person have a question? You can say your question as opposed to typing it in the chat box. Benga.
Yes.
So I have a bit of a strange question. Can you hear me? Hello?
Yes, Nonso. Yes, Nonso.
Yes, so my question is, Dr. Olakitan, how far do you think you are of clinical practice, such that if you somehow make a decision to go back into core clinical practice, how far off do you think, and do you think it's still something that can be a possibility for you in the future, for example?
Thank you very much, Nonso, for that question. I get asked that question a lot these days because people say, oh, you don't even talk like a doctor anymore. The honest truth is this. I hope I never have to work in the hospital as a doctor treating a patient for money. I still do it from time to time, I still do some little consultations, and most of my consultation these days is primary care. The moment you're saying something odd, extraordinarily, I will just refer you on. Or one of the things the job also does for us is that it puts you in a great circle of a lot of people. So it creates the opportunity for me, especially, to be able to have in my network any type of specialist or doctor that I feel that people who have consulted me for primary care might benefit from. So from time to time, I still try to, do that. But I hope I never have to do it to earn money. I also hope that sometime in the future, I can do a little hospital management. In fact, I hope that in part of my hopes that we can set up an organization that does healthcare investment. So in doing that, hospital practice might be part of it, but not working as a clinician in such a facility, but maybe working as a health hospital administrator. Yeah, if you understand what I mean. But for me to work as a clinician, I still do it from time to time, helping people out, and also helping them set up better appointments with people who can better help them. But to do it to earn money, I'm not saying I can't ever do it again, but I hope I never have to do that again. Thank you very much, guys.
Thank you, Nancy, for that question. I think it was actually on my mind as well, but kind of forgot about it. Do we have any other questions? We're actually way past the time, but we can still take one or two more questions if anyone has, preferably someone who is going to speak out as opposed to typing in the chat box. All right. Seems we don't have any question. All right, so I think we'll be rounding off now. So Dr. Jinadu, if there's one thing that I could just leave everyone, you've actually said a whole lot today. Well, if there's, should I say, just one thing that anyone on this session should go away with, what would you say that one thing would be in addition to every other thing that has been said so far?
I don't think there's anything new I have to say. I just want to reaffirm to you all that your thoughts are valid, your opinions are valid, and whatever it is that you think you want to do, they are valid. Go out and chase your dreams. Don't do it because everybody else is doing it. And if your dream is to make more money, please go ahead and make more money. If your dream is to make a difference, go ahead and make a difference. If your dream is to, whatever it is, go ahead and chase your dream. Don't chase anybody else's dream. Don't do it because they are doing it. Do it because you want to do it. And while you do it, do no harm. Thank you, guys.
Thank you very much, Dr. Jinadu. This was actually really insightful. And I'm sure everyone learned a thing or two or 5 or 10. So we've come to the end of today's conversation, and I would like to thank everyone present for being on the call. So just before we go, yes, can we actually unmute ourselves to tell him thank you? As opposed to typing in chat, but you can just tell Dr. Jinadu thank you very much for his time this Saturday afternoon, spending his time with us this Saturday afternoon.
Thank you, Dr. Jinadu.
Thank you,
This was
teacher.
really insightful.
I really appreciate being here with all of you. Kumi, it's still Saturday morning, by the way, but I do really appreciate being here with all of you, and I also wish you all well in your dreams and aspirations.
So I just put in the chat box the link to the form about the DWS community if you would like to be a part of that. I also just put in DW Stats, that is our handle on Instagram and Twitter, and on LinkedIn it is Doctors Without Stats. So you can follow any of the handles for more up-to-date information, and also check out the form I posted. Thank you, everybody.
Before we close this section, I just want to quickly say that for all of you who probably weren't able to ask your questions for one reason or the other, you can actually try to reach out to me on any of the social media handles at the name Olakitan Jinadu, and I'll try to provide some feedback. Thank you.
All right, thank you. So we can reach Dr. Jinadu, as he said, Olakitan Jinadu, on any of the social media platforms. You can see his name, but I'm just going to type that as well. Yeah, I just put that in. So thank you, everyone, and have a lovely Saturday afternoon.
Okay, bye-bye, guys.
Bye-bye. Thank you.